Well, hi, I'm Dr. Michael Mirander, and today we just want to have a medical minute on oral thrush. Oftentimes this is seen in the young infants. Hey, watch it. And it's very gross to look at a lot of the times. Besides, the child tends to get irritable, and oftentimes their feeding is patterns are changed. Oral thrush not only occurs in infants, but adults too. And a lot of times these adults might have poor dentition or oral prosthesis. Sometimes they are, sometimes they are immunocompromised. Some of them have HIV or AIDS disease. Some of them are diabetic. And sometimes people go on antibiotics or on chemotherapy. Or sometimes people just dry mouth because of their breathing pattern, or sometimes medications that they may be taking lends to disturb oral flora of bacteria, and then the Candida albicans, the one that causes the yeast, flares up. One has to bear in mind that the organism of yeast, Candida albicans, tends to live naturally in the vagina and also in the oral cavity. But oftentimes the number of these fungus are so low that one doesn't usually see them, and it's usually in certain circumstances that they flare more. For instance, during the periods or during pregnancy, and as we said, sometimes when they're on antibiotics, or sometimes even the oral contraceptives, and sometimes even the oral contraceptives, as I said, kind of paves the way for the fungus to flare. In any event, the treatment... Want to say something? What you want to say? Go ahead and say what you want to say, and then it will be my turn.
Hi, I'm Jamai. Okay, now my name
J-E-R-E-M-I-A-H. Go ahead.
J-E-I-M-I-A-H. Jamaya.
Okay. Alright.
Because that's my name, Jamaya.
Alright. In an event, we have to lend attention to treating this condition when it does occur. So in an event, we have to lend our attention to treating the condition. And oftentimes it's going to be an antifungal. In the kids, in the infants, nystatin is the most common one used by most physicians. And it comes in a well-prepared dropper of 100,000 units per mil. And the usual treatment is 2 droppers in each side of the mouth, or 1 dropper in each side of the mouth, 4 times a day, depending on the size or the age of the infant. Sometimes other antifungals are used though. The diflucan, the sporanox, the mycostatin or mycolog, Mycilex is the one often used by the immunocompromised patient, especially as thrushes that they use in the mouth. And usually the fungus will clear. One has to note that there are just certain conditions that lend to the fungus being there, oral thrush being there, and sometimes keeping it there. For instance, the mother's nipple is a source of infection a lot of times, because you never know who got it first, whether the infant's mouth became super infected, Candida albicans fungi, or whether the nipple was the source of the Candida albicans. A lot of times the mother will tell you that the nipples are sore, sometimes they're red and shiny, sometimes they are just searingly painful. And so you have to lend treatment to treating the nipples, as well as treating the child's oral cavity. And usually a cream is appropriate to the mother, while the topical medication is appropriate to the infant. One has to lend attention to the nipples, the nipple of the bottles that they use to feed, which must be clean and air dried as often as possible. And also the pacifiers are often a contaminating source of Candida albicans, and so one has to pay attention to cleaning them daily and air drying them well before, you know, the child would use them, if you really have to use them. For the adults, but sometimes in the children, sometimes unsweetened yogurt is something that is a good adjunct to add to the child's feed, or to have the adults to use, because it helps to fight against the fungal organism. Older people sometimes also use acidophilus, which also is very beneficial. So, just another medical minute here from Dr. Mirander on oral thrush. Hoping you'll understand its origin and some of the strategies you can use to avoid and to treat it. Until next time, Dr. Mirander here, wishing you have a good day.